Hello and welcome to Dr. Brainwaves. I'm Dr. Susan Raschal and this is Dr. Rena Azar. And today's video is going to be on low back pain. But not just low back pain, but the type of back pain that requires immediate attention. So a couple of points that I would like to make about low back pain. It is the #1 disability in the world, not just the United States, but in the world. And know that about 80% of people at some point in their life may experience lower back pain. Good news is that less than 10% of people will have disabling back pain. So that's also an important point. But today we're going to point out the times that you don't want to wait, take medication, and just chill, but you want to immediately get attention. And Dr. Azar is going to talk to us about some of those conditions.
So I'm going to discuss some of the conditions that are severe that we do not want to miss. And then we'll talk about the symptoms that would present accompanying your back pain that would make you want to be looked at and checked out in a timely manner. We're talking about within the same day. So obviously, we're talking about problems with the spinal cord. And I'm going to get this little drawing out briefly. We've got the spinal cord, and it's consisting of bony plates that have little cushions between them that are fluid filled. And the important thing here is that we have nerve that runs from the brain down the spinal column and then spreads out through the body. So here's a little close up. And the important thing to know here is that any disruption of the bony plate or the little cushion can pinch or push upon the nerves, and any kind of pinching of the nerve can cause certain symptoms. And sometimes those situations where the nerves are getting damaged can be critical. So people who have cancers can have a critical point of pushing on the nerves. People can have nerve trauma that is going to result in that nerve dying, so people can get paralyzed. Underlying problems can relate to trauma, to growths like bony spurs that reach a critical level of pushing on that nerve. Disc disease where the discs herniate, rupture open, push on the nerves in a way that can cause some permanent damage. The spinal column can close off. Either there's a natural process that can do that, or a growth within that area, or a blood collection, or an infection in that area can cause pushing on those nerve columns and the roots as they spread out to the body. And those can give death to the cells in the nerves and cause irreversible neurologic damage, meaning you can't move and you can't feel. So that's what we're trying to help you to avoid.
What kind of symptoms would they notice?
That's a good question. And the symptoms that you would notice if your nerve is being pushed upon and damaged are going to be numbness, tingling, weakness of the muscles associated with it. And for that reason, if you have those symptoms, you need to come in. So anything that results in severe pain, anything that results in a sudden pain, if it's trauma related or not trauma related, that needs to be brought to the doctor immediately. One special consideration, obviously people who've had some trauma will think, I've had a fall or a motor vehicle accident, do I need to get checked? Obviously, like we've referred to, severe pain, sudden pain after that needs to be evaluated. But special considerations are given even in minor trauma to elderly people or to people who have a known condition of osteoporosis, which is bone thinning, or to people who have underlying autoimmune diseases or are on immunosuppressants so that they have weak tissues. Those folks need to come in and be seen soon. In addition, bilateral numbness, bilateral tingling, weakness of the lower extremities, the lower legs, the feet with numbness or tingling. If you have symptoms on both sides, which is what we call bilateral, you need to bring that in. And this is one that people don't always think of, but if you have nerve impingement or nerve death because of being pushed upon the nerves and some cellular death in that area, you will get potentially bladder and bowel dysfunction. So a change in your bladder or bowel dysfunction, meaning frequency, urgency, especially leakage or inability to know if your bladder or bowels are full or are emptying. If you have those symptoms with back pain or a sudden change in those symptoms, that needs to be brought in immediately. So the kind of things that we're also looking for are infectious related. Believe it or not, people can get infections in the bone. IV drug users Diabetics, people who have any history of like a spinal tap or any kind of surgery in the spine can be at high risk for having infection in the bones.
We call that
Osteomyelitis.
osteomyelitis. So you may have heard that term and not know exactly what it is. Infection of the bone.
Once again, will cause back pain, but you're going to have some systemic symptoms: pain, fever, nausea, vomiting. In addition, we want to make sure not to miss other infections like pancreatitis, kidney infections. Occasionally malignancies can present with back pain. And finally, we like to also make mention that people who have ruptured aortic aneurysms can present. That's going to be the severe and sudden onset thing. That is unfortunately a very rare but severe condition that needs to be recognized, where people get a ruptured open large blood vessel that runs through the back of the body. And those symptoms are very dramatic and hard to miss. So certain types of back pain need to be brought in immediately. We are definitely going to have more videos on managing chronic lower back pain, recognizing acute lower back pain, what you can do to identify it and to treat it. There are a lot of things you can do yourself to help with back pain. Thanks for visiting Dr. Brainwaves.
Stay tuned. We've got more coming at you.